Bismillahirrahmanirrahim. Quote of the day. Give every day the chance to the most beautiful day of your life. What a win. I am Dr. Hussain Mahmood, PGL from Community Medicine. Today I am presenting on neonatal care under kind supervision of Professor Dr. Said Afzal. Learning outlines. Introduction to neonatal care, component of neonatal care, steps involved in neonatal care on national level. Recent updates and MCQs. Learning objectives. At the end of this presentation, participants will be able to describe about the introduction of neonatal care, aims of neonatal care, its components and progress at national level. And what is neonates? A newborn baby specifically a baby in the first 4 weeks, 48 days after birth. After that time, a baby is no longer considered a neonate. What is neonatal care? Neonatal care is the type of care that should be given to baby born either full term, premature, or sick in home or either in hospital environment. What is neonatal unit? Neonatal units are a part of hospital which provide care for babies who are born prematurely before 37-week gestation with a medical condition which need treatment or at a low birth weight. Importance. Since more than 1/3 of all child deaths occur within the first month of life, providing skilled care to the mothers during pregnancy as well as during the afterbirth greatly contribute to child survival. All newborns require essential newborn care to minimize the risk of illness and maximize their growth and development. Warm, normal breathing, mother milk, and prevention of infection are the basic needs of normal baby at birth. Objectives of neonatal care. The main objectives are observe and record the infant's vital signs, monitor weight loss or gain, monitor bowel and bladder habits, monitor activity and sleep pattern, and monitor interaction and bonding with parents. To provide safeguard against infection, initiate feedings, provide guidance and health instruction to parents. Neonatal care at home. The highest proportion of death of mother and newborn occur during delivery or within 24 hours of birth. In developing countries, only about 13% of mothers and infants receive postnatal care within 24 hours of a home birth. In response to this situation, WHO and UNICEF recommend a postnatal visit to a health facility as soon as possible after at-home birth. Where this is not possible, they promote home visit to mother and infant within 24 hours on the third day, and if possible, before and end of the first week after the birth. Immediate care of a newborn. As soon as the baby is born, dry him gently all over with a clean, dry cloth and discard the wet cloth. Wipe fluid from the nose and mouth with a clean cloth. Don't rub away the white film on the baby's skin, it protects the skin. Cover the baby with a second dry, clean cloth to keep it warm. Cover the baby's head. Check to see if the baby is breathing well. Once cord is cut, place baby on the top of the mother's tummy or chest skin to skin. Cover with a dry, clean cloth to keep both warm. Cover the baby's head. If the baby is not crying at birth, rub her back deeply to make her cry and take a breath. Don't handle the baby upside down, slap the feet and pinch the chest. The first hour after birth, when a mother has uninterrupted skin to skin contact, with the newborn to refer as the golden hour. This period of time is an integral factor in mother's breastfeeding journey if she chooses to do so. Skin to skin contact is even recommended outside of the delivery room wall. Kangaroo's care is a mother of holding a baby that uh, involves skin to skin contact. The baby, who is typically naked except for a diaper, is placed in an upright position against a parent's bare chest. Both mothers and fathers can do kangaroo care. Assess the baby's breathing and colors. As you dry the baby, check to see if the baby is breathing. Normal rate is 30 to 60 breaths per minute. The baby's skin color is pink. If the baby is having trouble breathing, gasping, or not breathing, quickly clip and cut the cord, leaving a stem at least 10 centimeters long. Call for help and start resuscitation immediately. What is Epper's score? A blue color of a tongue lip and trunk is a sign of lack of oxygen in the blood. A bluish color of only the hands and feet may be present after birth and usually does not indicate a lack of oxygen. Continuously assess the upper score at 1, 5, and 10 minutes. This is table of upper score in which we see activity, pulse, grimace, appearance, and expiration of the patient, newborn baby, and we categorize in 0, 1, and 2 point cardiac condition and give them scoring. If the Apgar score is 0 to 3, it is severely depressed. It's 4 to 6, it's moderately depressed, and it is 7 to 10, it's an excellent condition. Meconium stain what baby. In neonates born through meconium stain, amniotic fluid don't start breathing on their own. Suctioning of the mouth and nose should be done before initiating positive pressure ventilation. Deep and aggressive pharyngeal stimulation with the suction catheter may cause arrhythmias and should be avoided. Allow and cut the cord. Cut the cord within 1 to 3 minutes after birth for all birth while initiating simultaneous essential newborn care. Early cord clamping less than 1 minute is not recommended unless the neonate is asphyxiated and needed to be moved immediately for resuscitation. Don't apply anything on the cord clamp and leave it uncovered. Clean, dry cord care is recommended for newborn in health facilities and at home. Keep the baby warm. Newborn without complication should be kept in skin to skin contact with their mother during the first hour after birth to prevent hypothermia and promote breastfeeding. Cover the mother and the baby with a clean blanket or cloth. It's recommended that the best temperature for babies is between 20 to 22 degrees Celsius. Help the mother initiate breastfeeding. Help the mother initiate breastfeeding with the first hour of birth. Most newborn babies are ready to feed only as 15 minutes after birth. Help the mother with correct positioning, attachment, and suckling. Give the baby the first yellow breast milk to protect him from illness, colostrum. Mother should breastfeeding the baby whenever she wants to feed. Only feed the baby from the breast. No other foods such as water, sugar water, or butters are necessary and may harm the baby. Baby don't suck or sucks properly. Action to take. Mother should offer breast often help the mother to sit or lie comfortably, hold the baby body against her, have the body face the breast, hold the breast and touch the baby cheeks with the nipple so baby turns and open mouth. Fix the baby mouth on the nipple. Make sure baby is in a comfortable position to feed. Eye care. Within 1 hour after birth, give the newborn eye antimicrobial medication to protect the baby from serious eye infection. Give ARV prophylaxis to all HIV exposed neonates according to the National Guideline on Prevention of Mother-Child Transmission. Prevent bleeding. Give 1 mg of vitamin K intramuscularly to all neonates, including preterm after birth. Give 0.5 mg vitamin K IM to neonate less than 1 kg. Check if cord clamp is bleeding. If it is, put on additional clamp between the abdomen and the existing clamp. Neonates identity. Place the infant's identification band on the wrist of the ankle with mother name, sex, and the body on it. Weight of the newborn. It is not necessary to weigh the baby immediately after birth. All infants should be weighed after stabilization and warmth. A single-use paper towel or a sterile cloth towel should be placed on the weighing scale beneath the infants. Record all observation and treatment provided in the appropriate chart. Make sure these things happen in first 7 days after birth. Mothers and baby should see a health worker to be sure both are healthy. Give the baby vaccine to protect her from preventable disease. Learn when to come for next shots for baby. If wanted, choose a method to space the next birth for at least 36 months. Register the birth. Give the mother vitamin A to protect her and baby. Alarming sign. If the baby show any of these signs, see health workers or trained community volunteers right away. It's trouble feeding, less energy, hot or cold, trouble breathing, fits, infected belly button, eyes or skin. Baby's belly button, eye skin is very infected. Eyelid are puffed or red. Pus ooze from the eye or belly button. Belly button smell bad. Skin has a rash with pus. Eyes become yellowish. Neonatal resuscitation. High risk deliveries that may require resuscitation include less than 30-week gestation, meconium staining, fetal distress, non-congenital malformation, multiple births, malpresentation, maternal complications such as diabetes, hemorrhage, hypertension. In delivery room, for the very low birth weight infant in the stabilization room, remember thermal control is a major issue. Raise the air temperature of the stabilization room to maximum and raise the temperature of the scrub room to 25 Celsius. As soon as possible after drying the infant, cover the recommended food grade polyethylene plastic or pre-warm blanket. Post-resuscitation care. An infant who has required resuscitation must be close monitoring and management of oxygen, infection, blood pressure, fluid, apnea, pressure, blood sugar, feeding, and temperature. Be careful not to overheat the infant during or following resuscitation. Withdrawal of resuscitation. Discontinuation of resuscitation effort may be appropriate if there are no signs of life in an infant after 15 to 20 minutes of complete and adequate resuscitation effort. Neonatal care in hospital. Neonatal care is the type of care a baby born premature or sick receive in neonatal unit. Units are a part of hospital which provide care for babies who are born prematurely before 37-week gestation with a medical condition which need treatment or at a low birth weight. The word neonatal means newborn or the first 28 days of life. Babies are admitted in neonatal care for many different reasons. The main reason for baby to be admitted are the main They are born prematurely, they have low birth weight, they have a specific medical condition which need treatment in hospital. How are medical conditions treated in the neonatal unit? Neonatal unit treats a number of medical conditions. Your baby may have condition because they were born early. So if they were born at term, the staff will give you information about your baby medical condition. But if you were ever wants to know more, you can ask them. They will be happy to talk to you about any question and you might have. Why are there different level of neonatal care? There are different types of neonatal unit in the NHS and they are named depending on the level of specialist care they offer. Specialist care baby unit, local neonatal unit, neonatal intensive care unit, special care baby unit, sometimes called low dependency. This is for babies who don't need intensive care. Often this will be for babies born after 32 weeks gestation. Care can include monitoring their breathing or heart rate, giving them more oxygen, treat low body temperature, treating low blood sugar, helping them feed, sometimes by using a tube, helping babies who become unwell soon after birth. Sometimes a baby might be admitted to a special care baby unit for phototherapy to treat jaundice, but sometimes this condition is transitional. Local neonatal unit, babies who need a higher level of medical and nursing support are cared for here. This include breathing support, give them their white pipe, short time intensive care during short period where they should stop breathing, continuous positive airway pressure, feeding through a drip in their vein called parenteral nutrition, pulling treatment for babies who had difficult birth or unwell soon after birth, helping babies who have unwell soon after birth. Neonatal intensive care unit. This is the level of care for babies with the highest need of support. Often these babies will have been born before 28 weeks gestation or be very unwell after birth. Some patients are transferred to a different hospital which have neonatal intensive care unit before the baby was born. This is usually because the staff feel that baby would benefit from this level care because it is safer to transfer the baby before they are born. Babies are cared for here when they need breathing support given to their windpipe, have severe disease affecting their breathing, need to have just had surgery, and neonatal intensive care unit. All level of care may also be given to babies before from the local area. Transitional care. This is where you and your baby stay together in hospital while you and your team care for your baby. It means your baby is well enough to stay with you, either the postnatal ward or a neonatal unit with support from the hospital staff. You will be the hospital for 24 hours a day. Some babies born between 32 and 37 week gestation, babies with mild jaundice or feeding problem get the care they need in this way. Neonatal team. Nurses provide the most of the day care for your baby. They can answer your question, show you how to feed take care of your baby and arrange for your speak to the doctor. Doctors coordinate your baby's treatment. They can answer your question about your baby treatment, medical condition, and progress. Therapies. There are different types of therapies that specialize in different parts of your baby development. Physical therapy and occupational therapists are trained to help with the baby's physical and social development. Speech and language therapists are trained to assess your baby's ability to feed and swallow. Dietitians make sure that your baby gets the best nutrition possible. They can explain what nutrition your baby needs. Ophthalmologist and auditory technician. These members staff will check your baby eyes and ear radiographers. You will meet these staff members if your baby needs an X-ray or CT scan. If your baby needs an ultrasound, this will be carried out by the consultant or specialist in X-ray and scan. Community neonatal nurse, discharge nurse, social workers, family support workers, porters and cleaners, clerical staff, and administrations. The natal mortality rate in Pakistan in 2020 is 40.4. In 1975 is past 74.5. Over 65% of the total neonatal death occurring globally belong to just 10 countries. Pakistan ranked third amongst these 10. It is estimated that almost 3 lakh newborn dies annually in the country. At least reported natal mortality rate is 40.4 per thousand live births, accounting for around 7% of neonatal deaths happen globally. This is the percentage of newborn who have postnatal contact with health provider within the day of delivery is 64%. 20% is have early initiation of breastfeeding. 48% have exclusive breastfeeding. 57% have continued breastfeeding. 37% have high forage, and 69% have analyzed salt consumptions among all tested households. This is the new program help women and newborns survive and thrive in Pakistan, Northeastern Province, Khyber Pakhtunkhwa Health Department, UNICEF, and the United Kingdom Foreign Commonwealth and Development Office team and NORPAS program. KPK's Health Department has launched annual initiatives with technical support from UNICEF and generous funding from the UK Foreign Commonwealth Development Office and NAVAS program promotes positive change in behavior and attitude toward mother and child health care in KPMD, while supporting the provision of safe and essential health care for pregnant and lactating women to help mothers and children survive. Between April 2019 and August 2020, NAVAS mobile outreach team provide half a million people with access to essential basic health services such as antenatal and postnatal care and immunization, including more than 20,000 pregnant women who receive antenatal care through door-to-door outreach service. This is another UNICEF program initiative helps keep every child alive in Pakistan. Punjab Healthcare Department and UNICEF help treat sick young infants suffering from possible serious bacterial infection close to home, including during COVID-19. Working in partnership with Punjab Health Department, UNICEF has implemented the PSBI initiative to Punjab primary and secondary health facilities since 2018. The project is now implemented in 10 districts of Punjab, Pakistan, most populous province. So far, 245 doctors, nurses, and lady health workers have been trained on integral management of newborn and child illness, which include PSBI. This has already benefited 250 in 3 districts. UNICEF has also provided facilities with medical supplies. The initiatives has also been piloted in 2 districts of the neighboring state provides more training are planned in the near future. With support from UNICEF and PSBI initiative, has now reached a total of 682 primary healthcare facilities across Punjab. The government is expected to scale up the initiative across the province in the coming month. Then recent updates. This is an article published in 2020 neonatal mortality among preterm infant admitted to neonatal intensive care unit in India and Pakistan after comparative study. Abstract. Objective is to explore the potential reason for difference in preterm neonatal mortality in neonatal intensive care units in India and Pakistan. Design a prospective observational study. The project to understand and research stillbirth and preterm in Southeast Asia was conducted July 2018 to February 2020 in Setting 3 Hospital in Devanagar, India and large public hospital in Karachi, Pakistan population. Out of total 3,222 preterm infant enrolled, 1512 were admitted to study NICU. With who collected data from units including length of stay, diagnosed, and diagnostic test. Main outcome measures neonatal mortality test performed diagnosis ascertained result for infant of equivalent weight and gestational age neonatal mortality is Pakistan was twice then that in the India NICU. The mean newborn length of stay in Pakistan was 2 days compared with 10 days for India. Fewer diagnostic and other investigations were used to determine mental condition or guide treatment in Pakistan and ICU because of limited information from testing in Pakistan concerning clinical respiratory distress. Respiratory distress syndrome appear to be overdiagnosed. Various other conditions, including pneumonia, sepsis, necrotism, enterocolitis, and intraventricular hemorrhage, were rarely diagnosed. Conclusion in Pakistani cites the limited resources available to the NICU appear related to the shorter length of stay and decreased diagnostic testing, likely explaining the higher mortality. With improved care, reduction in mortality among preterm neonates should be achieved. Then MCQs. MCQs number one, a baby born on 12 January 2021 had complaint of severe dyspnea and cough on 18 Feb the same year. The baby is taken to hospital by her parents. She needs hospital admission according to trained staff. There should be a stay at nursery neonatal care unit, intensive care unit, child intensive care unit, and COVID unit. It's a
A.
nursery. A premature infant is delivered at 32 weeks of gestation. The baby is born with a weak cry, muscle tone appearance, somewhat lame. The body is weak, heart rate is 90 beats per minute, and respiratory effort are irregular. What would be the appropriate Epler score for the newborn at 1 minute after birth? 3, 4, 5, 6, and 7. It's
4.
B, 4. A medical student is asked to examine a newborn. The best approach should be is newborn examine are only undertaken by a senior doctor. Is the newborn examination can be undertaken anytime in the first 6 to 8 weeks of life. See, the examination can be performed provided that the body has been fed in warm and not unwell. A system-based approach to better than had to approach examination is delayed when the newborn is in distress.
A.
Let's see, the examination can be performed provided that the baby has been fed in warm and it is not well. The recommended room temperature for maintaining warmth for neonates is 20 to 25 degree, 25 to 28 degree, 28 to 30 degree, 34 to 37 degree, and above 37 degree.
D.
It's B 25 to 28. An infant born to the mother 40 years of age at one time. She is taken for warfarin for her medical condition. The baby born for her is about 2.6 kg. To prevent bleeding in such needs 0.5 mg vitamin K IM, B is 1 mg vitamin K IM, C is 0.5 mg vitamin K IV, D is 1 mg vitamin K IV, E is 1 mg vitamin K orally.
B.
It's B with 1 mg vitamin K IM. A full-term unit is born after a prolonged and difficult labor. The baby presents with poor muscle tone, breathing effort, and had birth rate 60 beats per minute. The body is pale with minimal reflex response to stimulation. What is the most appropriate initial step in the management of this newborn? Initiate immediate intubation and mechanical ventilation, chest compression, administered IV, perform suctioning of the airway, initiate cardiopulmonary resuscitation. It's initiate CPR. A male baby born to a mother at full term. Baby was in distress and passed grade 3 polio still before receiving babies having tachypnea. Immediate care for newborn at the stage should be a shift to transitional room, shift to NICU, dry and clean the baby and hand over the mother. This sectioning of mouth and nose should be done. Deep and aggressive pharyngeal sectioning.
B.
It's deep. Sectioning of mouth and nose should be done. Healthcare provider attended a delivery of a full-term newborn after the baby is born. The provider noticed the cord pulsating and observing sign of effective placental transfusion. What is the most appropriate action regarding cord clamping in this situation? Immediately clamp the umbilical cord to prevent excessive bleeding. Wait for at least 1 to 3 minutes before clamping the umbilical cord to allow for placental transfusion. Delay cord clamping for 5 to 10 minutes to ensure optimal blood volume transfer. Clamp the cord immediately and vigorously massage to the uterus to explain the massage of uterus to expanding placental delivery, perform cord milking, and facilitate rapid transfer of blood to the newborn. Let's be wait
B.
for at least 1 to 3 minutes before clamping the umbilical cord. A newborn infant is brought to the clinical for a routine checkup at the 3 day of old. During the examination, the pediatrician noticed swelling of body, skin, and sclera. The mother reports the breastfeeding has been going well and the baby has been eaten regularly. Which of the following condition is the most likely cause of neonatal jaundice? Breastfeeding associated jaundice, physiological jaundice, ABO blood group incompatibility, neonatal sepsis, breast milk jaundice. It's A,
B.
breastfeeding associated jaundice. Subsequent a full-term newborn is delivered via cesarean section. Upon delivery, the baby appears active with a strong cry, muscle tone, pink color throughout the body. What is the heart rate of 140 beats per minute? The body is spontaneous movement, the breathing well. Now, what would be the appropriate after-birth score for this newborn at this minute after birth? A is 5, B 6, C 7, D 8, E 9. It's
9.
9. This is key or MCQs, our YouTube channel, and thank you so much.